Good morning. My name is Shishir Maithel. I am a surgical oncologist at Emory University. And first, I'd like to welcome everyone. I know we have about 1,500 or so people registered for the conference, probably close to 700 patients registered. So really welcome to this amazing conference that's been put on for you all. I'd like to start out by congratulating and thanking Stacy, Melinda, and the entire CCF team. It's been an amazing 15 years. I have been completely blessed and honored to be part of it for the past 6 years. And I just cannot believe the progress that has been made through this Cholangiocarcinoma Foundation and the advocacy that is done for patients like all of you who are watching today. You know, it's an exciting time for cholangiocarcinoma in the sense that there's been lots of developments, a lot of which you'll be hearing about in the next 3 days. There's new drugs. We talked about the importance of molecular testing with the Mutations Matter program and all sorts of new developments. And as we continue to push the envelope with liver-directed therapy, chemotherapy, targeted therapy, and even liver transplantation. But one thing I think as a physician, we often don't do well enough is really understanding how all of these treatments and how all these developments affect you, the patient. As remember, we're not treating a disease, we're treating a patient who has the disease. So we really need to keep the patients at the forefront. And we need to focus on not only are the treatments working, but how do these treatments mentally affect you, physically affect you, emotionally affect you, and even financially affect you. So we are really geared toward patient-reported outcomes. And this is the survey that Melinda just mentioned on her previous talk. Emory has teamed up with the Cholangiocarcinoma Foundation and Citizen to do a patient-reported outcomes study. Now, many of you on the call or who are watching this probably say, well, I actually already did that study, and that's true. We had previously launched this survey approximately 2 or 3 months ago, and we had incredible responses, almost responses to the point where it was too good to be true. And in fact, it was. So unfortunately, I'd like to share with you that our survey through the social media that is our world today was hacked. And so I'd like to say it was robo-hacked. And a lot of the data we got was basically clouded with imaginary answers done by robots. So unfortunately, we were not able to use that data. So I sincerely apologize to any patients who previously filled out that data. Please know that it is all secure. Nothing has been shared. It's still in our secure databases. The only problem is that our data is now completely clouded with a lot of just basically made up answers by these robots. So it was a real doozy. Let me say that again. It was a real doozy when we heard that we had to really start over. But we have started over. We have protected the survey now. And I'm going to ask that all of the patients on this call and during the course of the conference, please fill out the survey again. Dr. Keilson is now going to take over and give a formal presentation regarding the study for any people who have not heard about it. And then after that, I'll come back and again, kind of close it off with a 1-minute thing. But you will all be receiving an email soon after our talk that will link to the survey. So I ask that you all fill out this survey during the course of the next 3 days. So at this time, I'll turn it over to my colleague, Dr. Keilson, who will give you a formal presentation regarding our study.
Thank you, Dr. Maithel. Good morning, everyone. My name is Jessica Keilson, and I am a clinical research fellow at the Winship Cancer Institute at Emory University. We are excited to be part of the conference this year and have the opportunity to share information about our important study with you. Today, I will be discussing patient-reported outcomes. Your experience is a priority. Patients with cholangiocarcinoma, much like other cancers, suffer from a variety of symptoms related not only to the disease itself, but also to the many different treatment modalities. The effects of disease and related treatments are vast and not only include physical strains, but also emotional and psychological stressors that are often not completely understood or addressed. Cancer care as a whole, among other things, incorporates patient response to treatment, preventing or limiting long-term effects related to these treatments, and focusing on continued surveillance and health management. All too frequently, clinicians focus only on a patient's objective response to cancer therapy and overlook quality of life and more subjective patient experience of disease as an important aspect of disease management. Health-related quality of life encompasses a broad range of measures, including how patients feel physically and emotionally as a result of their disease and treatment, their day-to-day functional capabilities, as well as social and family support. One additional aspect of quality of life that we don't often consider is the financial burden of disease and disease management and the role that it plays on overall well-being. The utilization of health-related quality of life measures has become routine in both clinical research and in the clinical setting. In research, these measures help to inform whether new therapies are effective and safe for patients. In the clinic, they help to evaluate patient well-being and overall satisfaction. The routine use of patient-reported outcomes in clinical practice has been shown to improve symptom control, increase utilization of supportive measures, and improve patient care satisfaction. However, despite the availability of validated questionnaires to assess quality of life, there are currently no prospective data on patient-reported outcomes in cholangiocarcinoma. Ultimately, the goal of our work is to merge our understanding of patient-reported health-related quality of life measures into our focus of cancer care in order to better identify areas for improvement in patient care, both within the clinic and beyond. Our primary study aim is to collect and evaluate health-related quality of life data from patients with cholangiocarcinoma, and we need your help. As part of the study, each patient will be asked to complete a survey. The survey will include a number of key clinical questions that will give us a better understanding of where you are in your disease diagnosis and management, along with a health-related quality of life questionnaire. We will be utilizing the Functional Assessment of Cancer Therapy and Comprehensive Score of Financial Toxicity questionnaires, two well-studied questionnaires that are commonly used in clinical research. The Functional Assessment of Cancer Therapy questionnaire is broken up into 4 main subgroups that evaluates physical, social, family, emotional, and functional well-being on a 5-point Likert scale. Additionally, this questionnaire includes a hepatobiliary cancer score that focuses on key questions related to cancer care of the liver and bile ducts. The Comprehensive Score of Financial Toxicity evaluates financial distress experienced by cancer patients. As Dr. Maithel mentioned, in addition to our partnership with the Cholangiocarcinoma Foundation, we are also partnering with Citizen, a free digital platform that Melinda spoke about briefly, and you'll hear about more and more as the conference goes on, which allows patients to collect and store their medical records. This service allows patients to better manage their healthcare data for sharing among clinical providers, for clinical trial matching, and getting involved in patient-driven research such as our study. Patients who enroll with Citizen and share their data will receive a $25 gift card and can claim a free Cure t-shirt celebrating the 15th anniversary of the CCF. Our main study objective is to gain insight into patient quality of life related to the treatment of cholangiocarcinoma. Ultimately, our goal is to connect the clinical information you provide with the valuable information we obtain from these surveys to better understand the patient experience of disease and identify areas for improvement in patient care. There are a number of ways of enrolling in our study and completing the survey. You can start by checking the notifications within the conference platform or within the survey section of the CCF booth. You can also visit cholangiocarcinoma.org/survey or find our study under the latest cholangiocarcinoma news section of the CCF website. Immediately following the session, you will also receive an email with additional information about our study, as well as a link to complete the survey if you'd like to participate. If you have any questions about the study or would like additional information, please contact me or Dr. Maithel directly. Thank you all again for the opportunity to share our work with you. We look forward to hearing from you. And here's Dr. Maithel.
All right, thank you all. Thank you, Dr. Keilson. So hopefully everyone understands the survey. Again, if you have completed this once before, I apologize, but we do request that you do it once more. Again, we really want to hear from you. It's so important, I think, as physicians that we understand how all of these treatments affect you. And ultimately, it'll really help us develop good therapeutic plans for each patient individually and really personalize the care. Again, when you do the survey, please do opt to enroll in Citizen and share your healthcare data, because again, going towards research, it'll only help improve the care that we can offer you. And again, the $25 is a nice little perk on the side. So immediately after this presentation, CCF, you should be receiving an email from CCF. Also, you'll be able to access the survey on social media. There'll be links throughout the conference, as well as you can see on the slides there, the different places you can look to find the link. It takes only about 10 minutes to complete. And again, it'll be extremely beneficial for all of us to help treat you. So thank you again. Again, congratulations to the CCI for 15 years, and a personal thank you for allowing me to be a part of this journey. Enjoy the conference.